Now, the fourth pillar of health, we may not think about it too much, but it's the restoration of our hormones. Certainly, if we have an elevated insulin level, well, that's not an optimal function. We need to have some insulin. But the problem that has come now, we talk about type 1 diabetes. We used to talk, and type 2 diabetes. We used to talk about adult onset diabetes, which meant that our blood sugar was elevated, but it wasn't because we did not have enough insulin, which was always the juvenile diabetes. They don't make enough insulin because there's an autoimmune reaction, is the common effect, that kills the cells that make the insulin. So we have to give them insulin. Now we're giving people that have adult onset diabetes insulin to lower their blood sugars, but they already have enough insulin. So we have to get lower your own body's production of insulin. And we have to do that through some of the other pillars of health that we talked about, which can include GI function, which can include our exercise, which can include our nutrition, but by gaining some control of our hormones. But there are other hormones that have a significant influence on our body that we may not be able to influence just by those factors. And those may be your hormones, such as your estrogen, your progesterone, your testosterone. And it's been shown that when we lose our estrogen, when we lose our testosterone, we have a higher incidence of Alzheimer's disease. Studies show that when a woman has had a hysterectomy in her younger years, that she has a significantly increased risk of developing into some of those conditions. So restoring the hormones can help with that. Restoring the hormones can help with our bones. Restoring the hormones can help with our vitality. Restoring the hormones to an optimal level from however we have to do it, whether it's our sex hormones, our thyroid hormones, our insulin. Restoring that is a very important part of our pillar of health.